Hello, I'm Dr. Marcus Owen. I'm a rheumatologist at Murfreesboro Medical Clinic. And a rheumatologist is an arthritis specialist. And so I take care of all kinds of arthritis problems. Arthritis, in its most simple definition, is pain and swelling in the joints. If you have painful swollen joints, you most likely do have arthritis. And beyond the pain and the swelling, you will have noticed that you just can't do some of the things you used to enjoy doing. You can't make a complete fist. You can't open bottles as easily. You can't do some of your daily housework. And you certainly can't do some of your recreational activities, such as playing tennis. When I explain to patients about the different types of arthritis, we talk about inflammation. Inflammation is redness, heat, and swelling that you would feel in the joints. And so the most common inflammatory arthritis is called rheumatoid arthritis. And in that condition, patients will have swelling and stiffness lasting for an hour or more in the morning, and often will get better with activity. In contrast, the most common type of non-inflammatory arthritis is called osteoarthritis. And in that condition, patients only have brief stiffness in the morning, and they actually feel worse towards the end of the day after they have been very active. And there are many other types of arthritis as well, including gout, which is a type of inflammatory arthritis. But to compare and contrast, we would say osteoarthritis is the most common type of arthritis in America today, and it is a non-inflammatory. And rheumatoid arthritis is our most common inflammatory type arthritis. I often tell my patients that my goal as a doctor is to get them back to doing the things that they want to do in their life, especially regarding physical activity. I hope that they can return to doing work, exercise, and play with minimal pain from their joints. And sometimes we can even accomplish that without taking any medications. I advise my patients to stretch, to use heat or cold as needed, to use braces if needed, and especially to do two kinds of exercise: strength to strengthen their muscles, and aerobic exercise, which will strengthen their heart and can often lower overall body pain. As far as medical treatments, including over-the-counter and prescription medications, we often start with acetaminophen, which is the generic name of Tylenol. And this medication is appropriate for many patients with a variety of health problems. The second common over-the-counter pain medication would include several kinds of anti-inflammatory medications. And these are more complicated because patients often have conditions such as diabetes, high blood pressure, or heart disease, which make these medications more dangerous to use. And so the doctor and the patient have to agree what may be the safest way to go forward with those types of medications. And beyond the over-the-counter medications, it really depends very much on which type of arthritis you're talking about. And we live in a very exciting time, in particular with rheumatoid arthritis, because we have many medications that completely alter the course of the disease. And so your future is now going to be different. Instead of becoming disabled, you're just a person with arthritis who happens to take medication. And I feel very fortunate to live in this time when we have so many options available for patients. And I can honestly say I go to work feeling excited about what I'm going to see that day and who I'm going to be able to help, because it makes a really big difference in people's lives.